Dr. Shravanti Reddy, fertility specialist and gynecologist at Shubha Fertility, LB Nagar. So the topic for today's discussion is what is low sperm count, how do you diagnose it and treat it. So first we should know what is low sperm count, the terminology of the low sperm count. Low sperm count is called as oligospermia. So basically, before going to oligospermia, I want to discuss what is the normal semen analysis so that you'll have a broad idea. Semen analysis according to WHO guidelines is you have to have at least more than 16 million per ml, and the motility should be more than 42% and the normal form should be more than 4%. So as we're discussing about the count part, so the count should be more than 16 million. Anything below 16 million is called as oligospermia. And oligospermia is divided into many categories like mild, moderate, severe and cryptospermia. So the mild categories, the count should be somewhere around 10 to 15 million, and moderate it should be 5 to 10 million, and severe is less than 5 million. And cryptospermia is when you take a semen sample, you have very rarely you find the sperms. Such samples are again centrifuged and searched for the sperms. How do you diagnose oligospermia? Generally, the patient won't have any symptoms with oligospermia. The only symptom we find is the patient is not getting pregnant. I mean, the couple is not getting pregnant. When we evaluate from the male partner with the semen analysis, we find oligospermia. What are the causes we see in oligospermia? Is commonly we see is infections. Generally, we see in patients with mums with defined orchitis, and they lead to infections and causing oligospermia. And varicocele is the more common reason also we find where count is low in the patients with varicocele. And in patients which have some genetic reasons, and also in the patients with some hormonal imbalances where the prolactin is high, in such patients also we see oligospermia. And some environmental exposure toxins, like the male partner is working in industries where exposed to heavy metals like lead and the toxin exposure. And also in the patients with poor sleep quality, too much of stress, psychological stress, and also excessive alcohol consumption and excessive smoking. These are the patients we often see with low sperm count and oligospermia. And generally, what is the next line of treatment when the patient is diagnosed with oligospermia? What happens is when patient is diagnosed with oligospermia, we evaluate both the couple. We see any female factors are there, male factors are there. Combinedly, we have to treat the couple. So how do you treat oligospermia? So what happens? Male partner is diagnosed with oligospermia. We take a detailed history exam. We do a detailed examination, and then we advise some hormonal investigations. So male hormones investigations like FSH, LH, testosterone, and estradiol and prolactin hormone accordingly. And after, we'll get a basic ultrasound done of scrotal Doppler, and then accordingly we'll diagnose if there is any hormonal imbalance. We correct the hormonal imbalance. If some patients require hormonal therapy, we give hormonal therapy. There is a chances of fair increase of sperm count in such patients. And if it is diagnosed as varicocele, depending on the grade of the varicocele, the surgery is recommended. Sometimes even if the surgery is done, 20 to 30% of the people conceive naturally after the post varicocele repair. And if they are diagnosed with infections, then we can prescribe some antibiotics and check whether there is any increase of sperm count post the antibiotic course. And also we can start giving them some antioxidants like CoQ10, astaxanthin and lycopene combination antioxidants. If the count is increased after all the treatment, whatever we've suggested now accordingly, then we can just wait for the natural pregnancy. But if the count is not increasing, even after the treatment, we can opt for assisted reproductive techniques. If the count is above 16 million increase, you can try for natural treatment. But if it is between 10 to 15 million, we can go for IUI. And if it is less than 5 million, it is always better to opt for IVF with help of ICSI. Thank you.